Peace be to you all. AsSalama'laikum. This is Omar Abdul Malik, health educator, physician associate. I gotta get used to saying physician associate. All right, so I'll tell you a bit about myself. If you don't know me, I've been in the healthcare field for 30 years, 20 of which has been as a physician associate. I've also been a health educator for many years. So at AsSalama'laikum, I taught, and I currently have been working as a hospitalist for the past several years here in Washington, D.C. So my question today came from, there was a student who was looking for shadowing hours and asked me if they could shadow me. I was like, sure. Maybe if they allow virtual shadowing. With COVID-19 pandemic, it's made it very difficult. Even before that, many hospitals had a crackdown on students doing kind of like volunteer hours in their hospitals. So that made me think about, I guess, the unfairness of that situation, because if you don't have a relative who's a doctor or who's got connections in a hospital can kind of hook you up, so to speak, such that you can come do your shadowing hours or get some type of meaningful patient care experience, it's going to be very difficult for you. In particular, if you live in an area that is health resource scarce, so there's no major hospital, maybe there's a little clinic. There's a PA that has a clinic way out in Nebraska, in a town of 1,200 people. I'll put the link in the description. But if you don't have anything like any type of support system like that, it's very challenging for you. I was very fortunate. The way I even got into healthcare, my mother is a retired nurse, so she let me come volunteer like in a CNA capacity. This is like almost 35 years ago. And then when I graduated, on my senior year of high school, my uncle, who was a pathology assistant, let me follow him in the hospital. He was doing post-mortem procedures or autopsies. So I got to tag along. So I got into the school of Stony Brook, and I actually got to help. I was trained on it and got to help perform autopsies as a college freshman. And had I not had that familial connection, there's no way, I'm sure there's no way I could have been involved in the health sciences. Certainly not on that level. So I guess I say all that to ask this question. Do you guys think that becoming a physician associate is becoming increasingly a thing for the elite, quote unquote? Is it catering to this kind of elitism? Much like medicine, if you weren't trained on test taking from the time you were young, and maybe your mom or dad are physicians, you have no clue how to get into med school or what that even entails. So you're lost in the proverbial sauce. And I wonder if becoming a physician associate is becoming like that, because now you need the right type of undergraduate degree. I'm tending to say, well, you should major in nursing. That'll take a lot of nurses off. That's okay. And you got to have a relatively high GPA to be competitive. Like I say, a 3.5. Fairly good GRE scores from most schools are the PCAT scores. About 2,000 hours of direct patient contact, you know, shadowing hours from a PA, if you know any. Then it's a master's degree. You know, some folks are pushing for the doctorate. So I see it becoming prohibitive for an increasing number of people, and I don't think that's what Dr. Eugene Stead had in mind when he first initiated the program, the PA program, back at Duke, you know, 54 years ago. It was meant for corpsmen who may not have wanted to invest that time to be medical doctors, but had good training, you know, being in war. But now it's become like, I got high school students, like I said in my other video, I got high school students telling me that they want to be PAs, which I never thought would happen. I thought, yes, most kids, oh, I want to be a doctor. PA, what is that? Now they're being PAs. It's getting a lot of, they want to be PAs. It's getting a lot more attention in the in social media and printed media. Oh, God. Gotta get up the hill. God. So that's it. You guys, so the question is, do you guys think that the PA career is becoming somewhat elite? And if that's good or bad for the profession? That's it. Gotta do my pull-ups. All right. I wish you guys the best of success in your positive endeavors. You can reach out to me. I'll put my contact information in the description. Peace.